In India, there are estimated 7.7 crore people above the age of 18 years and are suffering from diabetes, and nearly 2.5 crore population are pre-diabetics. More than 50% of people are unaware of their diabetic status, which leads to health complications if not detected and treated early. Hi, this is Dr. Enoch, your healthcare specialist from Impact Diagnostics and a pathologist. Today, we are diving into an important topic in diabetes management, the HbA1c test. This video will provide you with all you need to know about the HbA1c test. Before getting into that, what are the differences between diabetes and pre-diabetes? Let us dive into it. In pre-diabetes, the fasting blood sugar is between the range of 100 to 125 mg per deciliter, whereas in diabetes, the FPS level is more than 126 mg per deciliter. The two are oral glucose tolerance test values in pre-diabetics are 140 to 199 mg per deciliter, whereas in diabetics it is more than 200 mg per deciliter. The HbA1c values in pre-diabetes are 5.7 to 6.4%, whereas in confirmed diabetics these are 6.5% or higher. How do you confirm whether it is pre-diabetes or diabetes? It is by repeated testing of fasting blood sugar, correlation with HbA1c values. What are the risks of complications that are associated with pre-diabetes? It is giving an increased risk of developing type 2 diabetes and cardiovascular complications. Whereas in diabetics, there is a higher risk of likely to get heart disorders, kidney issues, neuropathy. What is the treatment approach in pre-diabetes? Pre-diabetes is considered to be reversible in many of the cases, with a special emphasis on lifestyle changes like dietary modifications, exercise to prevent the progression to diabetes. Whereas in case of diabetes, the main line of treatment is through medication, which is oral antihypoglycemics or insulin, and to some extent lifestyle modifications. How does this impact your health? In pre-diabetics, it is usually considered as reversible and progression to diabetes can often be prevented. Whereas in diabetics, it is a chronic condition requiring ongoing treatment. How do you monitor whether your blood sugar levels are adequate or not? What are the preventive measures in case of pre-diabetics? These are mostly the lifestyle modifications, that is your diet and your exercise, and to manage the weight and blood sugar levels, aiming to prevent the onset of diabetes. Whereas in case of diabetics, you focus on managing your blood sugar levels, blood pressure and cholesterol. Let's dive in back to the HbA1c test. What is HbA1c? Let's start by breaking down the term. HbA1c stands for Hemoglobin A1c, that is glycosylated hemoglobin. Hemoglobin is a protein found in red blood cells that carries oxygen throughout the body. A1c refers to a specific type of hemoglobin that has glucose molecules attached to it. Why is this HbA1c important? It is crucial in diabetes management because it provides an estimate of your average blood sugar levels over the past 2 or 3 months. It is not like FBS, which gives your immediate value. That is, the fasting blood sugar levels reflects the amount of sugar present in your blood in the current moment of time. Whereas the HbA1c, it gives the average of last 2 to 3 months of your sugar values. This means it gives doctors and patients a broader picture of blood sugar control compared to your daily blood sugar test. Who should get tested? All the diabetics should get tested for HbA1c for monitoring their treatment effectiveness, or pre-diabetics so that they can take precautionary measures and manage the condition well. Well, HbA1c should be monitored sequentially as well. For the pre-diabetics, it should be done every 6 months to 1 year, whereas in diabetics, it should be done every 3 months. Tighter control shown by levels of HbA1c in the 7% range or lower were correlated with 35 to 76% decrease in the microvascular complications like retinopathy, nephropathy, neuropathy in patients with type 1 diabetes. In addition to determination of HbA1c levels, prediction the progression of microvascular complications. How is this test done? Like any other blood test, the phlebotomist will collect a blood sample which is drawn from your arm, and it is subjected to various methodologies. The gold standard for running the HbA1c test is called high profile liquid chromatography, HPLC method. How do you interpret the results? For people without diabetes, a normal range is typically below 5.7%. Higher percentage indicates poorer blood sugar control. For individuals with diabetes, the target HbA1c level might vary, but it's generally around 6.5% to 7% or lower. Well, what are the factors that affect HbA1c? It includes your diet, your exercise, your medications, your stress levels, and overall health. There are some conditions in which there is a false low HbA1c value. That means even though your HbA1c value is high, it is falsely showing as low. What are these conditions? When you are in high altitude, or pregnancy, blood loss, hemolytic anemia, chronic alcoholism, chronic kidney failure, and liver cirrhosis, all of this will contribute to a falsely low HbA1c value. Vitamin supplementation can either increase or decrease the HbA1c level depending upon the method used for its measurement. Falsely high HbA1c value can be due to a lack of available iron in the load. That's why in iron deficiency anemia, infection-induced anemia, or tumor-induced anemia, hemoglobinopathies such as thalassemia and B12 deficiency can also show falsely high HbA1c values. Other causes of falsely high HbA1c values include hypertriglyceridemia, organ transplantation, and hyperglycation in certain ethnic groups. Immunosuppressants and protease inhibitors also cause falsely higher HbA1c values. Doctors use the HbA1c test results to guide treatment plans. If your HbA1c levels are consistently high, adjustments to your dietary management and medication and exercise level should be predicted by the doctor, and adequate steps needs to be taken. Regular HbA1c testing allows you to track your progress over time. It's an opportunity to see how lifestyle changes and treatment adjustments are positively affecting your blood sugar control. And there you have it, the HbA1c test, a powerful tool in diabetes management. Thank you for joining us today. If you found this video helpful, don't forget to like, subscribe for more informative content. Remember, proper diabetes management is a collaborative effort between your healthcare team and you. Stay healthy, and we'll see you soon in the next video. Thank you. This is Dr. Enoch signing off.